Hello, guys, parents, coaches, athletes. So excited to be bringing you this segment with Dr. Jason Levy, chiropractic physician here at Atlantic Health, home of Atlantic Sports Health. And really excited, Dr. Levy, tell us a little bit about your background and how you got involved with Atlantic Health and the New York Jets.
Well, presently I'm in my 10th season with the New York Jets, and Dr. Damian Martins and Dr. Dean Padovan from Atlantic Sports Health are our doctors there. And we work very closely to help keep the players on the field, and also if they're injured, get them back on the field as soon as possible. And I think that from working with Dr. Padovan and Dr. Martins, they saw that the players were utilizing my services a lot, and as a result, they asked, I had an opportunity to become have a timeshare here at Atlantic Sports Health, and I've been here ever since.
That's great. That's great. You know, obviously you work with a lot of soft tissue injuries, and
Yes.
you know, nowadays with so many athletes, young athletes playing sports, injuries are at almost epidemic rates. I mean, overuse injuries. Talk to us about some of the more common injuries you see, not only with professional athletes, but with the younger population. What do you typically see in your practice, and how do you treat?
Yeah, so a great question. We see, we treat every type of athlete there is. With the overhead athletes, such as swimmers or baseball players, volleyball players, we see a lot of shoulder issues. We also see a lot of elbow issues. With the runners, of course, hamstrings, and your soccer players, your hockey, lacrosse, you'll see groin, hips, calves, Achilles, pretty much everything these days. The kids are training, they're training a lot.
They are training a lot, and they're playing a lot. You know,
Yes.
they're playing all year long now, and
Yes.
and they're training on top of that. Sometimes I find kids either sometimes are doing too much, or in some cases not enough. Too much sports activity, not enough symmetry training or balance training, or developing a cohesive kind of body where everything works in unison. It's interesting how you talk about overhead athletes, shoulder injuries, obviously. Do you typically find that the activity a kid does in their sport leads to typical overuse injury or some type of injury?
A lot of times it does, especially if we're talking about an overhead athlete. You couple their activity on the field or in the pool, and then that on top of being a student where they are at a computer hunched forward, and on their personal electronic devices hunched forward. So very often they get out of balance. They get tight pecs, tight biceps, and their heads come forward, and as a consequence they can develop shoulder impingement and things of that nature. That's why they need to be working with you guys to help that.
Yeah, what's interesting, and I think the takeaway here for at least this segment and for our parents and coaches to understand, is that your body becomes a product of its environment, right? If you do something over and over again, you got to be aware that there's most likely going to be some imbalances created, or an overdevelopment of that specific movement or skill, whether it be sitting in a certain way, or whether it be throwing constantly or kicking constantly, or hitting a tennis ball constantly. There's going to be imbalances developed if you don't work on the opposing muscle groups to create symmetry and balance, and, as you know, get enough rest. I mean, right now, I don't think we're thinking about enough rest and recovery, which is really the magic potion. So this was great, and I know we're going to talk some more and have some more segments and talk a little bit more about recovery, but thanks so much for joining us.
My pleasure.
We look forward to bringing you more information with these segments with Atlantic Health.